Once that diagnosis is made, we have the right imaging. The imaging tells us relatively more or less what stage the patient is. We'll talk about staging soon as well. But there are other features that we get when someone's first diagnosed. There's lab work that's important. Now, people always ask, is there something in my blood work that can automatically tell me if I have cancer or not? And that's not necessarily wholeheartedly true. There are some cancers like leukemia or lymphoma or myeloma, blood cancers per se, that can definitely tell us or hint that the blood work is abnormal and there's some sign of a malignancy underlying that blood work. But with solid tumors, lung cancer, colon cancer, pancreatic cancer, breast cancer, blood work could be completely normal and there could be rip-roaring disease with normal blood work. But we are always looking at something called a CBC, or a complete blood count, and a CMP, a comprehensive metabolic panel. And within that CMP, we're looking at the liver function, the kidney function, the electrolytes, the blood sugar. Again, looking for signs of new onset diabetes, for example. On the second row here, the bullet here, CEA and CA19-9. These are specific tumor markers that really are looking at diseases of the gut tract. Now, again, do they 100% of the time, if they're abnormal, indicate you have a pancreatic or a colon or an esophageal cancer? No. But if someone does have a biopsy-proven diagnosis of pancreatic cancer, we can check something called a CA19-9 level. And if that's elevated, which a lot of times it is in patients who have locally advanced or metastatic disease, two terms we're also going to define in a few minutes, this helps us track whether their cancer is getting better or getting worse when we give them some sort of treatment. So it's just a level or an indication of treatment response, or how active the disease is per se. Again, it's not wholeheartedly accurate. We would say that this number, CA19-9, is probably about 80% sensitive, 75% specific. And what that means is that having an elevated CA19-9 doesn't mean you have pancreatic cancer. It could be elevated for other reasons. But there's a small subset of patients who have a lot of pancreatic cancer and don't have an elevation of that number. Maybe about 5% of people lack the antigen. They're called non-secretors. And so that blood test for them won't be reliable. But this slide just gives us a basic overview of what's necessary to diagnose someone with pancreatic cancer and some of the blood work we follow.